Folks, welcome back to the channel Techado, and in this episode, this is going to be the 11th episode of the COVID-19 series that I had started back in Feb and March. If you have not watched those episodes, I'll be just posting a link right up here on the top. You can watch the whole playlist. For all those who has been watching the channel, I think there's only like a group of like 60 or 70 people who is watching all the episodes of this separate playlist, and I have no purpose to stop this playlist. Only reason behind this is because it's an effort to spread the right information rather than giving misinformation, and that is the whole purpose of this episode. So folks, in this episode we are going to talk about something very concerning, because from like day one, from March, I've been telling that COVID-19 is also going to have a lot of comorbid diseases. So it's going to be it will be associated with a lot of diseases, and that's where things were going wrong, because a lot of physicians, a lot of like healthcare workers or healthcare professionals, a lot of scientists were not thinking about the comorbid diseases, and hence comes to our topic today, which is going to be Kawasaki disease and children. Now, Kawasaki disease can be presented in a later age also, but we are going to talk about this very rare disease. Now, at the back of me, if you are a health professional and you've just suddenly, for some reason, you're looking for some answer, which is totally valid, because this whole era of COVID-19 and this whole coronavirus era, or SARS-CoV-2 era, is a different era. And in our med schools, we do not study about viruses a lot. Like we study only little bits of it, bits and like small parts of it. In our books, like if you are following Davidson or Harrison, there's a small chapter, probably I think in page number like 1121. I think it is 1112. And I remember this because back in my med school, in my last year, I had a debate with one of my professors. Now you might be asking, what is this Kawasaki disease, and suddenly how are we seeing this? There are going to be a lot of cases, and actually right now I've heard few cases are actually getting this, few hospitals are actually getting this. Well, Kawasaki disease is basically a disease that affects the vessels or blood vessels, which means arteries, veins, any sort of medium blood vessels of an infant, of a newborn, and it can be up to 10 days and it can be up to 21 days, so it's very important that mothers, especially mothers, because fathers will not notice that much, but mothers will notice that you look into some signs, and this signs will allow you to alert your physicians, and you can have a word with them and ask them that, hey, I'm noticing these symptoms. Do you think there's something wrong? Should I be scared of anything, or like I should be worried about it? Remember this, folks. So COVID-19 is actually an RNA virus. You already know this. If you have not known this, then you should go and watch my episode number 1, where I've already talked about it. An RNA virus can be triggered to a lot of factors, like a lot of unknown diseases with unknown etiology. Like, for example, Kawasaki disease. One of its trigger factors is actually a virus. It can be genetic, it can be virus. So literally we do not know what is the trigger part of it. And to be very honest, the thing is that a lot of our books even do not talk about Kawasaki disease a lot. Only the super specialized people, those who go for super specialization. But the thing is that it also depends what sort of physician you're talking to. Are you talking to a super specialized person who is related to cardiology, like other fields rather than pediatrics, or you're talking to a general practitioner, or you're talking to an MD physician? I think a person who is a doctorate of medicine or MD is going to know more about these factors and will relate, or or will refer you to a specialized like doc and everything. So it's very important to notice this cardinal sign. So remember this: if your infant is crying a lot, if your infant is suffering from, so expression of pain, expression of muscular pain will be shown by an infant as excessive cry. So you're going to notice about something, that a situation where your child or your infant is having excessive amount of cry, which means that it's not normal for that infant to cry for such longer amount of time. Now, there's also one more factor you have to notice this, that if an infant cries a lot, that infant will get tired. And if an infant gets tired, there is a lot of factors that is involved to that. And that factors I'm not going to discuss because it's solely about the Kawasaki disease and COVID-19 together and how these are correlated and everything. Next most biggest symptom you're going to see is rash. So be careful, like any sort of rash that you see with fever, with temperature, with chills and everything, tongue is turning red and everything. Notice these factors because these 4 signs are pretty cardinal signs for something grave. And make sure you are taking your child or infant to an ER or talking with your physician about it. This is very, very important. Now, my job is not to tell you how this can be treated. Everybody knows that. Everybody in the healthcare profession knows that. My job is to know you, to show you the early signs of it so that you can spread this to a member of the family, to a person whom you know is expecting, to a person who has just given birth to a baby and you know them personally. So that's the reason I am making this episode. And I had told you in the last episode that I am going to make an episode where I'm going to talk about infants. Now, if you do not know what sort of category you are falling into and you have some comorbid diseases, go ahead and watch this video. I've made this episode like last week, and I have categorized high risk individuals and everything. And on the next episode, I've also categorized high risk individuals prevention. So apart from doing all the social distancing, wearing a mask and all that stuff, you can also follow these sort of procedures. And the tricky part is that do not wait for symptoms to aggravate. Never wait. If you are seeing rash and if you are seeing some changes in the tongue and fever and chills, do not wait. The reason we have behind of you not to wait is that the problem comes when this disease triggers something called multi-system failure. So do not wait for a long time. You see fever, chills at this era, like I'm not talking about 10 years back, the scenario and everything. Fever, chills, excessive cries, shortness of breath. Also, one more stuff, folks, if you see that your child is crying a lot of mothers have this theory that that means that the child requires, feeding. So make sure that you are not doing force feeding to your infant, because if you are doing force feeding to your infant, that milk might get, because of the cry mixed behind it, that child might take the milk and he might gasp, which means that the milk might enter into a wrong pipe, to be very into putting into a very nutshell, to be honest. And so make sure you're watching this cardinal signs, folks, watching, telling your friends and family, people, those who are expecting, mothers, those who are expecting, and friends of these mothers also, let all of these folks know about it. Now, Kawasaki disease is also presented on people, those who are suffering from any sort of immunodeficiency. So not only immunodeficiency doesn't only mean that it's going to be HIV or AIDS or anything, but also means that it's going to be hepatitis A, hepatitis C and everything. So as we progress, things will open up, things will become normal. As we progress, you're going to see that this virus is a trigger factor to a lot of other stuff. Same as that of, so RNA viruses have a very particular pattern. The pattern of RNA virus is that it actually inserts a different genetic code inside your DNA code, and your DNA tries to rewrite this genetic code. Imagine this, that if there is a fort and there is bodyguards all around the fort, your guards will swap from one entry point to another entry point, making the fort more vulnerable to one entry point. So that's it, folks. I hope you understood the grave importance of protecting your kids, a grave importance of protecting your family, and that's what this channel is all about. Techado is a channel that makes tech, gives you information and talks about mankind's progress to the future. I do not ask anybody to subscribe. It's a total personal choice. Okay, so take care. See you guys on another episode. Goodbye.